This is Sam from Curnexa. Just a little bit of background on the product. We've been working with the Cincinnati Children's Hospital Medical Center, which is one of the largest children's hospitals in the U.S., to develop an AI clinical support application which saves precious time for emergency medical personnel and clinical researchers. So to start, the user will log in with their Epic EMR credentials. They'll then be taken to the medical history summary where they'll enter the patient's medical record number and the symptoms that the patient is exhibiting and press submit. They'll then get back all relevant information from the patient's medical history along with additional important information. So our conversations with the Cincinnati Children's Hospital Medical Center revealed that emergency staff spends at least 15 minutes on each patient, sifting through their medical history within the Epic EMR, looking for information that's relevant to the symptoms that the patient's exhibiting. This takes precious time and also has room for human error, especially towards the end of a long shift, as you can imagine. And additionally, the patient's information is kind of spread out across the patient's profile, so it makes it even more time consuming and error prone. So just looking at these results, we can see information about the patient's medical history that's relevant to chest pain, including dates, lab results, and any sort of, some information about the patient themselves. So this process took much less than 5 minutes, and so saves about 15 minutes per patient, which over the more than 90,000 patients, emergency patients that CCHMC receives in a year, would end up saving up to 20,000 hours per year. This translates to around $3 million in staff costs, not to mention the vital seconds it saves for emergency patients. Okay, so moving on from the medical history summary, we have the research assistant. And on this feature, the user will enter the medical record number again, press submit, and they'll receive back a table of the patient's lab results. So again, talking to the folks at CCHMC, we found that compiling data for clinical research studies is quite the tedious and manual process of sifting through the Epic EMR again. Additionally, there are important details that aren't easily uncoverable and require meticulous searching various parts of the patient's profile. So we can see the results here from that patient. We can search another patient. And so this feature, the research assistant does all of the data compilation for the researchers so they can focus on analysis, saving literally thousands of hours, because it could take months to manually populate this data by retrieving the data, this table, by retrieving the data piecemeal from the Epic EMR. So again, the table, looking at the results, the table has the patient MRN, has the system and the code that tells us about the specific test that was run, and then the test name, so it's a little bit easier to interpret. And then it gives us the results, high and a low value, and the units for the results. The user can then download a CSV to their computer of the entire data. Okay, moving on from the research assistant, we have the clinical decision support feature. And in this feature, the user, and again, simply enters the patient's medical record number, clicks submit, and they'll receive next step suggestions based on the latest medical research, as well as a summary of the latest research that was used for creating this summary. Our conversations have, again, with CCHMC, have uncovered that the time-consuming task of utilizing clinical decision support platforms is relatively tedious. Doctors often use expensive platforms like UpToDate to find the relevant medical standards for dealing with a patient's given condition. The problem with this is it's, again, time-consuming, expensive, and is a compilation of secondhand information from doctors based on the latest research. So this feature uses multiple Epic APIs to collect the patient's medical history, then uses any conditions to search PubMed for any relevant studies via the PubMed API. Then an LLM uses the medical history and the research articles to provide the clinical decision support. So we can look through the steps that were suggested, potential next steps that were suggested to the medical professional. And then we can see the abstracts of the articles. So then, if the medical professional would like to dig into these articles to learn more, they know exactly what the title is. And the abstract gives some information about the outcomes of the study to give them some quick context for moving forward. So this feature makes the process of finding the current information about conditions a lot quicker, a lot cheaper. A lot of hospitals don't have budget for things like UpToDate, and it's also directly from the source. So we're not looking at secondhand information. We're looking directly at the science. So this is the final feature and concludes the demo for the 2024 YC summer batch. And just want to thank you all for watching.